Welcome back to my show, Time with Dr. Nita. This is a show where we talk about women's health, our day-to-day health activities, problems that can arise, and ways of solving them. There's a hormone in pregnancy, we call it progesterone. It's kind of a relaxing hormone. So when it does that, it relaxes your intestines as well. And it slows down the progress of food from your stomach right throughout. So some people realize that they will have a lot more constipation at this time. It's advisable that you eat a lot more fruits and veggies, and then you drink a lot more water to ease the constipation. At this time also, because your uterus is getting a little bigger, it rests on your blood vessels, the ones that are inside you. So we advise that you sleep on your left side. It all helps to increase or make the blood flow to your heart better. When you sleep on, like, let's say your back, your uterus rests on the big blood vessels. We call them the aorta and the inferior vena cava. They're like giant PVC pipes, which is taking blood onto your heart and all other parts of your body. So imagine a PVC pipe that's a heavy object is resting on, flexible pipe that a uterus is resting on. When it happens like that, it prevents smooth flow of blood into your heart to other parts of your body. So the woman, you yourself, you feel that you're uncomfortable. So we advise that as much as possible, when you're sleeping, you sleep on your left side. When it happens like that, the uterus is lifted off the blood vessels, and it improves blood flow to your heart and other parts of your body. Sometimes when it's uncomfortable, you can put pillows in between your legs. It's tried and tested and it works. It just makes your sleeping position more comfortable. At this time also, you realize that you're having a lot more heartburns. This is also due to the progesterone. Because it relaxes the intestines, there's a junction between your esophagus and your stomach. There's a physiological gap there. We call it esophageal sphincter. What the progesterone does is that because it relaxes it, it makes some of your stomach contents move up into your esophagus. And because your stomach content is acidic, it makes you have a lot of the heartburns. So we advise at this time that you eat small quantities at frequent intervals. Some women also realize that when they take an antacid, it helps. It's equally good. Either you take the small quantities or you take the antacids, which will help to relieve you of your dyspepsia or heartburns. At this time also, you begin to feel the baby move. It's very, very interesting. It feels like when you meet a boy that you like and then you have these butterflies in your stomach. That's how it feels like. There's small fluttering movements in your stomach. It comes and then goes. That's when you know that your baby is starting to move. As the baby grows older, it becomes more, you begin to feel it more, and it becomes more defined. It makes you know that that's your baby, but in the beginning it just feels like small butterflies, or sometimes like when you're hungry, how your intestines rumble. That's how it feels like. As time goes on, it gets harder and firmer. At this time also, you may realize that you have a lot, I don't know whether we know what varicose veins are. There are these veins, some women have these veins in their legs. When they get pregnant, it becomes a lot bigger. Yes, so at this time, you may realize that those who have it, their veins are becoming bigger. And then you may have a few people who have some episodes of nosebleeds. They are all due to the pregnancy hormones. The good news is that very few women have these problems. And then when you have the varicose veins, there's these tight compression stockings that you can wear, which will prevent the veins from getting bigger and also increase the blood flow to your heart.